Hemostemix announces Dr. Giannetti and Dr. Cecere as co-lead medical consultants, cardiovascular clinical trials. Here to tell us more, of course, is Chief Executive Officer, co-founder, and president of Hemostemix, Thomas Smink. Thomas, so give us the 411 here. Tell us about these doctors and what this really means with them being on as co-lead medical consultants.
Dr. Cecere and Giannetti are the chief of transplant medicine and the recently the chief of cardiology at McGill, which is one of the top 10 heart centers in the world. And they've done their due diligence on Hemostemix, they've done their due diligence on ACP, and they're convinced that it will be the first to patient approved autologous stem cell therapeutic to treat heart disease. So it's a very significant step forward for the company. They're also stem cell scientists, so they're not just looking at this from the perspective of their heart practice, but they're also looking at it from the perspective of stem cell science and the competition.
Yeah, well said. I mean, definitely when it comes to introducing new technologies like this, there's a lot of evangelizing involved in getting people on your side, especially professionals, and showing them that this is something that is very viable. And it seems like you've done that here. So then walk me through what they're going to be handling at this point.
Yeah, so they're going to start with the financing bailiwick, help with respect to due diligence and answer investors' questions, institutional investors. Questions with respect to ACP, and then design a clinical trial in heart disease. We're just going through that process now. Then there'll be lead investigators and bring other lead investigators from top 10 heart institutions to the clinical trial.
Wonderful. So I guess, Thomas, ending things on a personal note, tell me how you feel about this press release.
Well, this is a very significant step forward for the company. As you said, it's one thing to evangelize. It's another thing to bring experts to the table who will do that evangelizing for you. And then that's really what this is. This is bringing the top heart transplant surgeon and one of the top cardiologists in Canada, certainly, and globally, to the Hemostemix project, and it's very, very significant. It represents, from a value perspective for investors, it represents further de-risking of the investment.
Yeah, well said. This is definitely just another milestone you guys have clocked up lately. You guys have been working hard, and I'm glad to see it. Congratulations. Thank you, everyone, for watching. If you guys got any questions, don't be afraid to send them over. But Thomas, any closing words from you before we go?
Well, again, we've been under enormous strain due to market circumstances. I think the valuation now is sub 10 million. This is if there is ever an entry point to take stock, this is it. And join us. I would encourage you to join us as shareholders.
You guys heard the man. Also, don't be afraid to check out the website below and let us know your thoughts. But for now, stay tuned for another update coming soon. And Thomas, please have a wonderful day.
You too, Michael. Thanks very much.